अक्टूबर का महीना है, ब्रेस्ट कैंसर अवेयरनेस का मंथ है, तो इसलिए हमने सोचा कि आपके साथ ब्रेस्ट अवेयरनेस पे एक सेशन हमें करना चाहिए, क्योंकि अभी ब्रेस्ट कैंसर बहुत तेजी से बढ़ रहा है। एज पर द डेटा, एज पर द स्टैटिस्टिक्स, हर 4 मिनट में एक महिला इंडिया में डायग्नोज होती है विद ब्रेस्ट कैंसर। आई मीन every 4 minutes one woman is diagnosed with breast cancer. Every 13 minutes we lose a woman to breast cancer. काफी भारी नंबर्स लगते हैं, है ना, जब हम इन नंबर्स को सुनते हैं। लेकिन इसमें अच्छी स्टोरी ये है कि more than 85% of the breast cancer, they are preventable, they are avoidable. हम उनको बिल्कुल अपनी जिंदगी से बाहर रख सकते हैं। ये सबसे अच्छी स्टोरी है, और इस स्टोरी के ऊपर संजीवनी लाइफ बियॉन्ड कैंसर काम करती है।
I would like to welcome Dr. Prateeti Barman. Dr. Prateeti Barman, as an associate professor, teaches social work and sociology in the Faculty of Humanities and Social Sciences of Assam Downtown University, Guwahati. Dr. Barman has completed her BSW and MSW from College of Social Work, Nirmala Niketan, Mumbai. She has an additional master's degree in sociology. She did her doctoral degree from the Department of Women's Studies, Guwahati University. Beside working in various government and non-governmental organizations of India, she served as an assistant editor to a scientific journal in Asian Institute of Technology, Bangkok. Besides having 13 research articles published in peer-reviewed journal and book chapters, she has authored a book titled Changing Perception of Freedom and co-edited books titled Document on Peace Education and Hukia Perspectives from Social Sciences and Humanities. Dr. Barman is a life member of National Association of Professional Social Workers in India and Indian Sociological Society.
The whole thing has been talked about. Ruby ma'am spoke so nicely about the awareness and the intensity of breast cancer in Indian context. Then Dr. Tantia has also talked about how prevention can save so many lives of the people, and I will be talking from the social workers perspectives, where I feel prevention is very, very important aspect, and that can be done. And at the same time, we also need to keep it in mind that we do have some underserved communities in our society, and how do we address them in a more approachable manner when it comes to breast cancer. So is it moving? The slide is moving?
No, ma'am, it is not moving. Yes, ma'am. Now you can try. Yes, ma'am.
Okay. I have just taken 2 pictures from WHO, World Health Organization, and this is depicting 2020's data, where if you see this data, you can see that the number of newly cases in Indian context is very low compared to our population size, and this is only just 25.8 numbers of cases per lakh population, whereas if you compare it with the population of USA, it is which is very, very high. However, the next slide also talks something very grim, because the death toll in terms of cancer or survival of cancer patients is higher in terms of the number reported compared to USA. In this context, we would like to see how the Indian scenario is working. So in Indian scenario, it is the numbers are less. however the death tolls are more. There are various reasons why these things are happening. First and foremost is the healthcare infrastructures, where I feel it is the most important aspect, because places like Northeast India, where I belong to, here the infrastructure, healthcare infrastructure is extremely poor, and we in Northeast India we have a huge number of cancer patients. Earlier they used to move out, but things have developed over the time, and now we have few cancer hospitals here in Northeast India, so they are getting treatment here. So again, another aspect why this healthcare infrastructure is important, because when it comes to the underserved communities, they live in the remotest areas belonging to. I'll be coming to the different communities which I'm talking about. Then another aspect is the access to screening and treatment aspect. Screening is very important aspect, which is again lagging behind in Indian context, and again it is more lagging behind in terms of Northeast India. Then the socio-economic disparities among the communities. Then there are cultural beliefs and customs. Then when it comes to policy intervention, that is another aspect. I'm not going into detail of these things, which are because these are topics in itself and which needs further deliberation. And I feel here the most important aspect is the community engagement and support, where we can play a role, very important role in terms of prevention part. Breast cancer, in fact, in Indian context, has ranked among number one cancer among Indian women with the age adjusted rate as high as 25, which I have said it in the first part itself. And evidence suggests that the incidences of breast cancer in India is increasing significantly over the few decades. It is more common in the urban areas than the rural areas. So, who are the underserved communities in Indian context? People belonging to scheduled caste and scheduled tribes, religious minorities, people with disabilities, people living in poverty, migrant workers, homeless people, people living with HIV/AIDS, sex workers, and the queer community. Queer community basically is an umbrella term comprising the LGBTQIA plus community, and these are communities where I feel where we need to intervene more, where we need to reach out more, and there are various reasons why they have lagged behind, and what they have their own issues itself. And top of it, if they are cancer patients, then it's a double burden for this group of people. And so if you see on these underserved communities often face barriers to different reasons, and there are barriers. These are like lack of awareness about the importance of screening, that is low cancer literacy, because they don't get to know about that there is a disease like cancer which can be preventable, and they don't have that idea. There is no awareness level among you it's when you work with the community people, you will be surprised to see at the rural areas, or even in the urban slum areas, there how people do not have ideas. Though there are posters, there are awareness programs happening, but still there is a lack of understanding and the importance of screening, that how is it important for them to go for screening. Then access to screening programs, as because they are lacking the information already, so how they do not know where to go, how to go about. So that is another aspect which is having constraint on them. Then another aspect is the financial constraints, and if you look at these communities, they are most of them scheduled caste, scheduled tribe communities are already yes, class difference is there. There are some people who are upper class among the caste only, but majority of the population are socio-economically underprivileged. So in them, then we are also talking about people like sex workers, we are talking people like homeless people, we are talking about people who are HIV/AIDS patients, we are talking about people who are of same sex couple, transgender. So again, there is barrier in them, uh, which is creating a sense of being excluded from the mainstream society. So, and another aspect is their financial aspect, and top of it we have the cultural and social barriers to seek healthcare. Here I would like to talk about the intersectionality of of gender and caste system, because what is intersectionality? It is something to do with the society is based on, where a caste is the first thing, that you belong to a lower caste, and top of it you are a woman. There is patriarchy in our society. These patriarchal norms and customs do not allow us to give priority of our health. So those things leads to this whole negligence of your healthcare, whole negligence of your not looking into the self, whole the whole thing of that your health is not a priority. Your sufferings is not a priority. You will end up going to the hospital almost when you are going to die. Very rarely you will be given treatment. Here the decisions of your treatment is taken up by the elderly of the family, then your husband. They will decide whether your health aspect needs some kind of treatment or not. If they feel it is not needed, then you are not given. And top of it, you belong to a lower caste community, where again you are subjugated. So this intersectionality again has a very very big role to play when it comes to accessing the healthcare facility. And along with it, the inhibitions towards our own body, inhibitions towards our own where we feel ashamed of our bodily changes, ashamed of not looking into us. So breast cancer needs self examination, going all these things need some kind of touching yourself, looking into your own health, going to the doctor, where they will be also examining you. So there are certain inhibitions, and that is also again stopping you from taking the healthcare benefits. So in this context, as the time, due to the time paucity, I have made it very short. I feel the non-governmental organization and the higher educational institutions play a very very crucial role here in terms of creating awareness camps, because awareness camps can prevent a lot of things, create awareness among the people, that literacy in terms of what is cancer, how it can be detected, how it can be prevented, how what are the things we keep it in mind. All these things can be done by the non-governmental organizations and the educational institutes, because remote areas can be covered by the higher educational institutes, and where community service is a part of the curriculum, where students can be involved, teachers can take part into it. Then another aspect is that besides these awareness camps, community based services by the NGOs, there should be a partnership between the NGOs and the government, and it has been done already. Things are happening at the grassroots level. So this partnership can help them, but at the community level, at the I feel these there should be some centers, so that constant support is there, constant service is there, where they can go and talk to someone or show it to someone, because government hospitals are dearth of health personnel at this moment, especially in Northeast India, especially in the state of Assam, where we have so many medical colleges, but we do not have doctors and other healthcare providers. So somewhere here the paramedical staff and the NGOs can play a crucial role in terms of providing community based services. Then palliative care providers, it is another aspect where I feel the NGOs can play a very pivotal role, and there are trust and organizations which are doing this, where to manage the symptomatic management and end of life care can be given to the patients, because in some cases the patients at times leave the medical service due to lack of money, monetary constraint. So here this group of people can be taken care of by the NGOs. So with this uh, I request you to reflect on these areas to understand and empathize with a cancer patient belonging to underserved community to overcome these barriers and survive and lead a productive life. Because again, as I said it, queer community or LGBTQI is another group of people who are not there are a lot of issue among them where they do not get to access the healthcare facilities. There is discrimination, and at times healthcare providers are not trained to take care of them, and most cases the LGBTQ group do not go for the healthcare facilities, and they do have a high number of cancer patients among them. So that is another aspect, and we really need to think about them as well, along with the other underserved community of India. With this, I end my presentation.
I really want to extend my thanks to NMDC, which is doing a great job in nation building as far as their core strength is concerned. But उसके अलावा बहुत ही socially aware organization है, and इस तरह के webinars जो हम करते हैं उनको हमेशा support करती है, and because of that support we are able to reach thousands of people. तो आप लोग जो हमारे साथ Zoom पे directly अभी connected हो, इसके अलावा this webinar will be live on Facebook and other social media platforms, and I'm sure a lot of people will benefit because of this webinar. So thank you, NMDC. Also a very big thanks to Fino Bank, who has come forward to support this webinar.